Are you approaching your golden years? On this show, we're talking all things health, from the doctor's office to the gym and back at home. Welcome to Health in Retirement.
Welcome everybody to Health in Retirement, the weekly talk show that gives you golden advice for your golden years. My name is Trey, Basa, and this is our pilot episode. We're here to talk about, in a very casual manner, everything Medicare related, so you have a better idea of how to manage your health and retirement. I'm joined today by my co-host, Cory Hiebert. Welcome, Cory.
Hey, Trey. Great to be here today.
So, today's theme, New Year, New You, New Plan. We are 1 month into the new year, and I don't know about you, but I have had a number of clients reaching out about a number of clients or a number of card issues or carrier issues. They're confused about everything that's going on and the changes that we set them up for in the previous open enrollment. Why don't you start off talking about a little of the changes that we're seeing with the Medicare system as a whole?
Yeah, so every year January is a very interesting period just because changes happen so quick in Medicare. And this year especially, you've been in this industry for 2 years now. You know that we normally get notified about different plan changes or what's happening as we look into September, maybe early September. And this year was kind of odd because even as insurance agents, we weren't notified about a lot of changes that were coming until October, early October, which is right when open enrollment is starting. So we have this rush of people getting in and wanting to come and meet with us. And we are just dealt this brand new set of information coming for us in 2024.
You've been with Market Medicare Advisors a little bit longer than I have. How many open enrollments would you say you've been through?
Yeah, so this is my third open enrollment that I've got to go through, and it's been one of the most interesting.
Getting that update about October is kind of late because October 15th is the beginning of open enrollment, right?
Yeah, so we can start, the rules on it are kind of funny. We can start talking about plan changes on October 1st, and we can start introducing, what's that new Part B premium going to be? What are any changes and regulations, talking about the drug plans? But we can start talking about that October 1st, which doesn't help if we don't get the information until October 10th. Which is 5 days before open enrollment, and I've already had 30 meetings with people, and I just don't have the news that I'm supposed to have for them. So one of the biggest changes that we did see, and it's something that we expect to see every single year, is those Part B premiums, because the Part B premiums, we're really just told this is what they're going to be. And part of our job here, especially within our office, we're kind of blessed to have the financial advisors and the tax advisors here within our same doors to help people financially plan. And part of that financial planning is what are we going to be expecting to pay on that Part B premium. Now, every year we have kind of a general guide as to what we can expect those Part B premiums to increase to. And we see that whenever we get the cost of living adjustment. So Trey, what was that cost of living adjustment for this year?
The cost of living, or COLA, was 3.2%. So we saw millions of Americans get that extra 3.2% in their Social Security checks every month. But that is going to increase, or there is a correlation between the increase in Part B as well with that COLA increase.
Yeah, and it's normally a pretty good indicator as to what that IRMAA adjustment, or not IRMAA adjustment, the Part B premium adjustment is going to be whenever we see that cost of living adjustment. So we saw the 3.2% increase on the Social Security checks. We should see roughly a 3.2% increase on the Part B premium. But this year that was not the case. We saw a little bit more than that 3.2% increase. And we saw a premium increase from $164.90 last year up to $174.70. So not outlandishly large, but also a little bit higher than we might have expected it to be.
But it's important for our listeners to know that 174.70 is only the base amount. Cory was hinting towards it a little bit earlier. IRMAA, good old Aunt IRMAA, she's gonna come knock on your door if you're gonna exceed a couple of income thresholds, depending on how you file and how you filed 2 years ago. So as we've been talking about it, IRMAA stands for Income Related Monthly Adjustment Amount, and they're gonna look at your taxes 2 years ago, how much you made, and what you filed, and they're going to determine your Part B premium, which is unfortunate because this past year, everybody was getting those annual notice of changes, the updates to Part B and the IRMAA thresholds, what felt like a little too late. I remember getting clients in office with the Medicare and You book, the 24 version, and I was like, oh, great, maybe this is going to be the update I needed for Part B. Nope. It said, stay tuned.
Yeah, that's Trey. That was such a funny thing for me to witness, because you get this Medicare and You book and you expect, it's titled Medicare and You. How am I going to look and fit into this Medicare puzzle for 2024? And, even as an insurance agent, I kind of look forward to my clients bringing in that Medicare and You book so I can kind of see what the federal government wants them to know on an annual basis. But this year, Trey was not kidding. Inside that book, it would literally say the Part B premium is $164.90 for 2023. 2024 rates have not been determined yet. And it's the Medicare and You book for 2024. So it's printed 2024's information, but then inside the book it says, we don't have 2024's information yet. So then I have to wonder, why did my tax dollars go to pay for a book that doesn't even have the right information in it?
Kind of a slap in the face, but it serves as good kindling for the winter.
Yes, absolutely. If anybody's looking for some fall sleep material, it's crack open that Medicare and You book. But Trey, as much as we can harp on and sit here and talk about the premiums and whatnot, we did see one fantastic change come for 2024.
Tell them, what was that big change?
Yeah, and that came in the prescription drug plans.
Yes, sir. Oh my goodness. Prescription drug plans changing for the better, and we do see these changes year after year. But what was the big change to prescription drug plans?
Yeah, so the biggest change that we did see is anybody that's been in these prescription drug plans knows that there are typically 4 stages of payments that you're going to go through. You're going to start off with the deductible stage. Deductibles typically only going to apply to tier 3, 4, or 5 medications. And once that deductible's met, you move into that initial coverage where you have clear and defined co-payments for each tier of medication you're taking. Once you hit a certain limit, you then move into that gap coverage, also referred to as the donut hole. And then you stay in that gap coverage again until you hit a certain limit, and then you move into catastrophic. Now, traditionally, whenever we've talked about the catastrophic coverage, you've looked at a flat 5% of your total cost of medication. And Trey, you know this as well as I. Some of these medications are $10,000 for a 1-month supply. So 5% of that $10,000 is still quite a bit of money.
Yeah,
but one fantastic change that we have seen for 2024 is if a client hits that catastrophic coverage, their co-payment for drugs goes to 0.
Yes. Golly, you have no idea how many times I would sit down with a client and we would go over projections for the year. And then as soon as they hit catastrophic, they're still paying, 5% for the rest of their scripts for the year, but it's still costing hundreds and thousands of dollars because of those high-tiered drugs.
Yeah, well, you got to think, putting this into more rational terms, who's the type of person, Trey, that is going to make it to catastrophic drug coverage or make it to that final tier?
Yeah, somebody who has a lot of medical needs, lots of prescriptions.
Well put. Somebody who's got a lot of those medical needs, and just a couple of expensive medications. Those brand name medications. I've had diabetics in my office that in the first month they go to pick up their meds, they move through deductible, initial, and gap coverage all the way through one pickup. One pickup.
Golly.
And now to be able to quote those people out and say, hey, yeah, this $3,000, it's still a lot of money. I'm not going to downplay that. But that's the cap. Like, once you pay out that $3,000, you're not going to have any more drug expenses throughout the year.
That's that. And I think there are going to be maximum out of pockets lower than that in the coming years. Can't guarantee anything, but that's kind of the trend that we're seeing with how these prescription drug plans are evolving over the time.
Yeah, we're definitely seeing the federal government start to dip their hand into what drug companies are allowed to charge anymore. We saw it a couple years back with that $35 insulin cap,
Yep.
which we'll definitely talk a little bit more about that cap in future episodes and about how that cap can be a little bit deceiving. But we're definitely seeing the federal government step in and play a bigger role into what these drug plans are able to do.
If you aren't tuned in to the changes in the Medicare system or even federal regulations, you guys got to stay in the know. Reach out to us at 316-252-8707, or you could email us at mail@marketmedicareadvisors.com and have a greater conversation about some of the changes coming to your plans today. But that brings us to our next segment, our client case study for today. We're going to talk about one of our good pals, Greg, and we're going to talk about how his contributions to his Social Security and Medicare taxes and a couple of inheritances he had is going to hit him hard his first year on Medicare. So just a quick recap. Greg is a construction worker, doesn't have any solid form of health insurance. He actually goes around from site to site on contract to contract, and he does his thing. But what happens is it doesn't guarantee him any of that health coverage. So when he came in about 3 months before his 65th birthday, Greg came in and talked to me about getting enrolled into Medicare. And we talked about his eligibility and what we could see him paying for this, that, and the other for his Medicare system, or for his Medicare Part B, and pretty much the whole year. But as soon as we signed up for Medicare, he got his card and he also got a notice. You want to talk about that notice that clients can get in the mail?
Yeah, so it's right along with his card, Greg was given a Part B IRMAA letter. So again, Trey had mentioned this in the beginning. There are tons of acronyms in this Medicare world, so I like to try and break them down for you. IRMAA standing for the Income-Related Monthly Adjustment Amount. So Medicare, I kind of joke and say it's as close to socialism as the United States gets, because everybody over 65 is kind of guaranteed, as long as you have your 40 working credit hours, access to this health care. So what helps keep it from being a totally socialist concept is the IRMAA. If you make more money, they want more money in premium. Living the American dream. You get punished for making more. So for Greg, this contract work is very beneficial for him, being 1099. He has the ability to jump from one job to the other because one may pay more. Now, the downside on that is that inconsistent healthcare coverage. So Greg, of course, getting towards his later years, tons of experience, he's making pretty dang good money.
And on top of that money, he received 2 inheritances from a good old hunting buddy and unfortunately his mother that passed. And it gave him those inheritances 2 years before he turned 65, which is the exact time frame that IRMAA is going to look back at. So that contract work plus those 2 inheritances did put him over that threshold for that year's Part B premiums. He did have to pay only for 3 months. When he signed up for Medicare, he had a birthday later in the year. He only had to pay for 3 months, but we also had to sit down and have a conversation about, okay, what do your taxes look like for this year? What forms do we need to submit? Because looking at some of those numbers, he wasn't going to meet the threshold for the next year. So We needed to reduce his Part B premium.
Yeah, Trey, and this is, again, I'm going to reference this several times throughout this podcast, where you and I are very fortunate to be in the position that we're in, because we can go right down the hallway and we can talk to financial advisors, and we can go down the other hallway and we can talk to our tax advisors. And I was talking with one of our financial advisors the other day, and a CPA, one of our CPAs, Josh Sikora, was walking by. And we kind of just had this epiphany of, whose job is it to tell an enrollee that they're going to have an IRMAA charge? Is it the financial advisor's job to have planned 2 years ago to make sure that we're below any IRMAA limits? Is it their tax advisor's job to stay in the know and make sure they know where those limits are? Or is it our job as the insurance agent to know about IRMAA? Because IRMAA has to deal with the taxes, and taxes have to deal with your financial plan. And for Greg's case, kind of a little bit sad that he had never been over the IRMAA limit before, except for the 2 years previous to getting up to that Medicare age. So, of course, he had not been working with our tax advisors or our Financial advisors, thank you. So we weren't able to kind of guide him, but that's so common, Trey, that we see people increase their income right before they're ready to start Medicare. And then it's kind of our job and our tax advisor's job to help kind of backtrack and prove the financial history.
It's a balancing act between all of these different sectors of retirement. And if you don't have a plan put together, it can bite you when you actually turn 65 or when you hop onto Medicare, just like in Greg's case.
Yeah, absolutely. Now, fortunately enough, with the help of our tax advisors and financial advisors and us, we were able to get that IRMAA charge reduced. But it doesn't happen automatically.
Nope, it does not. You need professionals to talk about it with and get these numbers solidified and have a plan to get these things to move into retirement, to get these numbers reduced. And that brings us to our final segment. This episode, we're going to call this segment Ask a Guy, Ask an Advisor. I probably should.
Ask an Advisor.
I feel like everybody does Ask an Advisor. We're gonna grab a question from a viewer. Submitted to our email, mail@marketmedicareadvisors.com. Comes from Judy in Kansas. Judy writes, I'm 64 years old and I need to know pretty soon, how do I even start enrolling into Medicare and Social Security? Everybody says I need to start at 65 and I'm so confused with the entire process. Judy, thank you so much for submitting your question. We're going to dive into that right now. Cory, when you're talking with a client approaching 65 and they have the exact same question, how would you start helping?
Okay, so for Judy, I'm going to focus a little bit here in the beginning on the last half of her statement. Everybody says I need to start Medicare at 65. Having worked in this industry for 3 years, I have heard so many mistruths. Things that people are told, that they maybe read from a .com website. Never trust information from .com, only trust information from .gov.
Yep.
But that is just a complete fabricated lie. That is not true at all. So the first thing that I want to address here, Judy, is that you don't and you are not required to start Medicare at 65 if you are maintaining creditable coverage. That would mean that it's coverage equal to or greater than what Medicare alone is willing to provide. Judy, if you are still working, your employer's insurance might be the right option for you. Now, on the other hand, I've also seen it play the other way, where even if you want to continue working, or if you're getting ready to retire, Medicare may be the right answer for you, and you can continue working while receiving Medicare. But Judy, I do, the biggest piece of advice I have for you is number one, of course, meet with a trusted advisor. We do this day in, day out. It's our job. And make it easy on yourself and sign up for an SSA.gov account.
That's right. So, Social Security Administration accounts can be a hassle to sign up before, but it'll help fast track the process when you're actually ready to sign up for Medicare. Your SSA.gov account bring you to a dashboard to look at your Social Security and projections at when you can take it out, as well as have that Part A, Part B Medicare application about halfway down. That's going to wrap it up for today's episode. If you have questions like Judy, or you want to have a greater conversation about Medicare, you can always give us a call at 316-252-8707 or submit a question. And you can always reach us at mail@marketmedicareadvisors.com. I'm Trey.
And I'm Cory.
Thanks for coming in. See you next time.
Unless otherwise indicated, all client and prospect names mentioned on this show have been changed to protect the identities of the individuals discussed. The content provided is intended for informational and educational purposes only. The views, statements, and opinions expressed herein are those of the individual speakers. This is not endorsed or affiliated with any U.S. government agency, the Social Security Administration, or associated with any federal Medicare program. We do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-Medicare to get information on all of your options. All rights reserved.